If you have a Medicare health or prescription drug plan, you should know you only have until the end of open enrollment December 7th to make changes to your 2017 plan. You might be happy with what you've got, or you might find something better. Let's talk about your options with Dr. Kara James of the Centers for Medicare and Medicaid Services. Good morning.
Good morning, Mary. How are you?
Hey, we're doing great. And if you don't mind, I'd like to start by underscoring the date here, December 7th. Why is that significant?
Well, that is significant. That December 7th date is the last date in which individuals can make a change to their plan. And as you noted, if they're happy with it, they can keep it. But if they'd like to make a change, December 7th is the last day in which they can do that. Otherwise, they will not be able to make a change until next open enrollment period late next year.
This is a loaded question, I know, but what do Medicare beneficiaries need to do? And this probably varies person to person, but generally, what do they need to do now during open enrollment?
Absolutely. There are really about 5 things we're encouraging people to do. The first is to review their plan notice to see what changes are coming to their plan in 2017. The second is to think about what are their health care needs and what are their changes that they most need to see in their plan. Is it that they would like to have a new provider, or do they have a new medication that they want to make sure is covered? The third is to review their plan options. There may be something out there that is lower cost or better quality, and they can see the quality ratings in that fourth area through the star ratings. Each plan has a star rating between 1 and 5, with 5 being higher quality rated plans. And finally, that they can look and see if they can qualify for assistance to help cover their financial costs. And they can do all of this by going to our website, which is medicare.gov, or if they'd like to talk to someone, they can call the call center at 800-MEDICARE, or if they prefer to sit down with someone face-to-face, the Nebraska Department of Insurance has a program that is available at 800-234-7119. Again, that's 800-234-7119. And they can call and schedule an appointment to talk to someone face-to-face.
I'm so glad you brought that up because, you know, the website is awesome. And you know, nationally some great resources, but so many of our viewers I know would want to be able to meet with somebody here in their neighborhood and close to home. So it's good to have that number there on the end. Who can participate in Medicare open enrollment? I don't want to assume that everybody knows the answer to that.
Right. So a Medicare open enrollment is available to those individuals who are currently enrolled in Medicare. And so that's a little more than 300,000 beneficiaries there in Nebraska. And we want those who particularly have a Medicare Advantage plan or a prescription drug plan to take a look at those plan changes that may be coming for the year and to see what makes the most sense for them, and to do so by that December 7th deadline that is quickly approaching.
Okay, so what happens, because this is the other part of it, you know, like not 100% of the people are going to get there. What happens if you miss the deadline?
So if you miss the December 7th deadline, you will be staying in the plan that you currently have. If you would like to make a change, unfortunately, that December 7th deadline will pass and you will not be able to do so until next year's open enrollment, which again is late in 2017, so you will have to stay in the plan that you have.
All right, Dr. James, some good information today, and I know it's a very busy time of year for you, so we appreciate that you carved out a few minutes for us. Thank you.
Thank you for having me.
Mike, over to you.